Okay, hello everybody, and welcome to the Bachelor of Science in Nursing info session with BCIT. Before we get started, I just want to say that this is our first time doing this on Microsoft Teams. We normally in the past have used Zoom, so I'm going to say right now that any bumps in the road, any tech issues tonight, my apologies for that, as we're just getting used to a new system on our end. My name is Erin Ruggieri. I am one of the marketing coordinators with BCIT's health science programs, and I will kind of be introducing the session tonight. And then we'll be hearing from Jill Kerrigan, one of our Bachelor of Science in Nursing program heads. And then we'll also be joined by Maggie. She's one of our program advisors at BCIT, and she'll be able to give you guys a lot of information on the application process and admissions and things. Continuing on, the British Columbia Institute of Technology acknowledges that our campuses are located on the unceded traditional territories of the Coast Salish nations of the Squamish, Tsleil-Waututh, and Musqueam. And as I mentioned earlier, our agenda is welcome and introductions. I'm doing that right now. Presentation and program overview with Jill, program advising with Maggie, and we'll have some time for Q&A at the end, but you are free to ask those questions in the Q&A function as we go along. And with that, I'm going to pass it over to Jill. Jill, did we want to do those polls right away now?
Yeah, why don't we start with the polls first, Erin?
Okay. First time doing polls on Teams. Okay, let's launch this first question. Okay, hoping you can see that. How many nurses are there in the province of BC? 10,000, 15,000, 25,000, 35,000, 1 million. Okay, and I don't know, I just hit few results. I don't know if you guys can see the results too.
Yes, we can see them. I think I can anyway. I only see 2 responses though, Erin.
Oh, then I don't know what happened with that. We'll go to the next one. But Jill, do you want to give us the answer to that one?
Sure. So the correct answer would be closer to 35,000.
35,000.
35,000 nurses in BC.
Okay, I'm going to launch this one. Which post-secondary in BC graduates the most nurses each year? So which is the biggest nursing program in BC? UBC, BCIT, Langara, or Douglas? Of course, there's other programs as well, but we're only giving you the choice of these 4 for which one graduates the most. In the interest of time, I'm going to hit view results on that one. Only 4 responses. You guys are being quiet tonight. What's the correct answer, Jill?
I can't see the responses, but the correct answer is BCIT. It's the largest program and within graduates the most amount of nurses in BC. So thanks for sharing that, Erin.
Perfect.
Okay, so as Erin said, my name is Jill Kerrigan, and I'm one of the program heads in the BSN program here at BCIT. And I just want to welcome you all to this session. I'm very excited that there's now 52 of you here that are have some interest in the nursing program. I pursued my career in nursing a little over 20 years ago, and very glad that I did. So I'm hoping that you guys will all get a little bit of information here in the session to help inform your choice as to whether nursing's a career for you, and specifically if the BSN program is the program for you. Okay, so to start off with, what is the Bachelor of Science in Nursing program? So just some quick facts about the program. It is a 3-year program. There's 3 terms each year with a total of 9 terms. With that being said, you do still get most of July and all of August off because we have 12-week terms. And our program is only offered on a full-time basis. There's certainly a mix of clinical, lab, simulation, and theory classes in every term. So right from term 1, week 4 of the program, you get to experience clinical. So that might be different than other programs. So with our program, it's you get right into that clinical setting. And the clinical, when I talk about clinical, I mean a mix of both clinical, simulation, and classroom lab sessions. And right from week 4 in term 1, you get to go into the clinical practice setting. So into the community or long-term care assisted living facility we have in term 1. And every term we have a mix of clinical, theory, simulation, classroom setting where you're learning the skills, all of that in each term. And as you progress through the program, you have more and more clinical hours when you get to the end, and then you have in term 9, you have all of your clinical hours and no theory course for that term. We have a variety of clinical practice settings ranging from community to acute care. And what's unique to BCIT, and I'm going to mention this a few times, is that we have the specialty programs for the whole province. We have them at BCIT. So we're really fortunate where our students get to take 2 electives in a specialty of their choice so that they can pursue some of their interests. And I'll get into that a little bit later. So in the end of the program, you graduate with a Bachelor of Science in Nursing degree, and then you write your entrance exam and you can start working as an RN right away. Okay, so BCIT has a brand new health science center, and it's the largest building, largest simulation center in Western Canada. So we're really fortunate to have that. We have rooms, like you see in this picture, we have rooms that look just like a hospital room might look like, where our students get to practice with these robotic mannequins that we can program them to say short phrases, they blink, they breathe, we can attach them to IVs. So as much as real life as we can get, and that's what simulation is great for. So students get to go into the lab and practice their skills before they're having to do these skills in the hospital for the first time. And it helps build their confidence, as you can well imagine, to be able to practice this skill before they're actually having to do this on a patient. So lots of simulation at BCIT, lots of hands-on practice, which is great. And so what does a BCIT grad look like? We have, we call these graduate attributes that we strive for every new grad to have based on after they've went through our program. And so the first of this is professional. So nursing is a professional career. So we do expect our students to uphold certain standards of practice, and these would include attending class. It's not a program where you can miss a bunch of classes and expect to do okay. The way that we have our classes set up, you do a lot of the reading and whatnot at home, and then you come to the class and work with the material. So go through case studies and stuff. So you really do need to commit to doing your work ahead of time before coming into class. And so that's part of the professionalism piece. And we expect our students to really represent BCIT and act in professional manner, especially in particular when they're wearing the BCIT scrubs. A leader, our grads take charge of situations because they're planning care for clients. Advocate, our students advocate for clients to ensure they're receiving quality nursing care. And collaborator, they work with many members of the healthcare team, and within our program we have these simulations that you do with other healthcare programs to get a little bit more experience and how you can work as a team with other healthcare professionals. Global citizen, so our grads do advocate for change to address issues in social justice and healthcare inequality. Lifelong learning, our grads are committed to continuous learning and updating their practice through self-directed learning. And then lastly, communicator. This is a big one in nursing. We teach our grads to communicate with empathy and compassion, but also to be assertive with both clients and members of the healthcare team. And so that's why you see within our program, we have a lot of communication courses because we know the impact of quality communication with safe patient outcomes. Okay, next slide. So what makes a successful BSN student? So definitely students who are able to manage stress and anxiety effectively, and they have the resilience to overcome obstacles. And I think this would be fair in the profession as a whole. There will be obstacles presented in your way. There will be quick decisions you have to make as a nurse. So certainly having that growth mindset where just knowing that there will be failures and setbacks along the way, but as long as you can learn from those experiences and hopefully change the way that you do things, that is definitely helpful as if you're thinking about being a nurse. Students should be effective communicators because we know that that impacts patient safety. So fluent in written and spoken English. And so this it also ties into the professional piece of nursing. So you need to be able to communicate with not only the clients, but also their families and members of the healthcare team. And if you have related work or volunteer experience, especially in the hospital, maybe care home or group home, if you have lifeguarding experience, if you have leadership experience in a sports team, these are all things that could help you take on that leadership role as a student nurse. It's not required, but I just think it could be helpful as you pursue your nursing career. Math and science are basic requirements for the nursing program. In terms of math, you don't have to be doing big mathematical equations, but nurses do use math when they're administering medication. So something just to be aware of. Next slide, Erin. Okay, so why become a nurse? Well, it's certainly a career where you won't get bored. So for those of you that are looking to get into a career where you're not going to be doing the same thing day in and day out, nursing is definitely for you. There's also so many different areas that you can work in as a nurse. So you might start and graduate working in the hospital, and then maybe you'll get into research or working in home care setting or specializing in palliative nursing, so end of life nursing. So many different things that you can do. There's also a lot of career stability. I'm sure you know there's so many jobs out there as a nurse. I don't think as a nurse you will ever be without work or ability to find work. And also, people often say that they want to become a nurse to have an impact on patients' lives in a positive way. So to make changes in the way healthcare is delivered and to advocate for patients. And these are common things that we hear as you're thinking about, is nursing for me? So what does a registered nurse do? I thought I would just list here some of the common things that we would do. So first off, we assess patients, and right from term 1, you will be learning the basic healthcare assessment. So taking blood pressure, heart rate, listening to lung sounds, assessing skin, overall mental health and well-being of the patient. You take their health history so that you can start to make connections about what you noticed on your health assessment and maybe what might be going on in the patient's lives and their health history, what they might be predisposed to. We then take these findings and analyze them to get an overall picture of our patient. And this is called clinical reasoning, and you'll hear this a lot in nursing. This is the way that you're expected to think like a nurse, to problem solve and to see how these connections might lead to a nursing diagnosis and lead to the type of care that you'll be providing your patient. So once we analyze these findings, we come up with some interventions. So a plan for how we might help the client manage some of these. And some of these interventions could be administering medications. They could be providing education, assisting with personal care, completing some other types of nursing skills, such as dressing changes, foot care, bunch of other different types of things. Nurses are focused on the overall health of patients and a population and provide education on preventative health as well. So in things like immunizations, maybe things like stroke management, what are the signs of a stroke and what are some ways that you can decrease your risk of having a stroke, those types of things. And then lastly, nurses also provide end-of-life care, and something that people might not think about and might be a passion of yours. And we're certainly seeing that more and more in the community where nurses are involved in that. So I'm also often asked, what does a typical day look like for a nurse? And so I just highlighted on here what it might look like for a hospital nurse that's working typical hours, which is 12 hours, 7 to 7. And the rotations are usually, if you're full-time, 2 days, 2 nights, and then 4 to 5 days off. So you come on shift, you get report from the night shift, so that you can properly plan your day. You then go in and start assessing your patients and start doing that nursing thinking, like I was talking about, where you're starting to analyze, okay, what are my priorities? What do I need to be most concerned about with these patients? What's a plan? What can I do to help get them home? What other healthcare professionals do I need to talk to? You administer medications, you, like I said, talking a lot with the healthcare team, and documentation is another big one. Always recording your findings. And that can look different depending on where you are in your clinical setting. Some hospitals are doing electronic charting, and a few hospitals are still doing charting by hand, but that's slowly being phased out. In terms of the job situation and where do nurses work, still about 55% of nurses work in the hospital. We do have some that work in the community and long-term care, followed by other employment settings. And the other employment settings could be, like I said, research, education, maybe some private clinics nurses can work in. So there's lots of different areas that a nurse can work in. And in terms of jobs, I just included this one article where it says there's almost 4,300 unfilled nursing vacancies, but this is from 2022. So I suspect it's even higher right now. So like I said, lots of jobs that are available for you when you graduate. And I think most of our students do get job offers before they even graduate. So that's it's really nice going into a program knowing that you will have a job when you graduate. So in terms of the career outlook, I mentioned that nursing is I don't want to say it's really challenging. It is a challenging career because there's a lot of thinking that you need to do as a nurse and a lot of decisions that you need to make, but that also leads it to be quite rewarding because you're seeing that impact on patients and hopefully patients and clients improving and meeting their health goals. I certainly don't have any regrets entering the nursing profession. I'm glad I did. We know nurses are in demand worldwide. So if you take a program in BC, you do have the ability to work worldwide. It might mean you write a different licensing exam to be able to work where you want, but across Canada as well. And I have several friends that work in travel nursing that travel throughout Canada, taking on nursing contracts, just as a way to explore different areas of the country. So yes, our grads can work globally, and I said I was going to hit this a few times about the specialty nursing options after graduating. And because BCIT, BSN students do get to take a couple specialty courses when they're in the program, they also have a little bit of an advantage to be able to work in those specialty areas when they graduate. It doesn't mean you have your full certification when you graduate, but you have 2 courses towards your certification, and it might mean that you can work in your specialty area once you graduate. And then lastly, in terms of career growth opportunities, there's lots of further education you can do. You can be a nurse practitioner and be running your own clinic. You can get your master's, PhD in nursing. There's research. There's lots of things that you can do with your degree. So what are some other practice areas that you can work in? I said most nurses do work in medical surgical units in the hospital, but there's also public health. These are nurses who give immunizations, well baby clinics. There's home care, so nurses that are visiting patients in their homes to provide dressing changes. And these nurses are also doing some end-of-life care, emergency nursing, critical care like ICU. So patients who are needing probably be ventilated and needing more one-on-one support. There's also mental health nurses, and global health is another one, thinking about traveling or looking at global healthcare dynamics. Also, administration, teaching, research are some areas that you could get into. So the specialty programs at BCIT, if you're wondering what types of specialties do we offer, so pediatrics, pediatric emergency, and pediatric critical care. Perinatal is care of moms that are giving birth. Perioperative, these are patients who are in the OR. Neonatal, so little tiny babies that you can look after. Critical care, emergency, high acuity. So difference between high acuity and critical care is just the amount, basically how sick a patient is. They can go from critical care to high acuity and then to being able to be on a ward as they start to improve. And then lastly, nephrology, which is things like kidney dialysis and kidney transplants. Exciting news, the BSN bursary that the government has let us know about a few months ago, that nursing students will qualify for $2,000 per year from September 2023 until August 2026. So that is great news. And in addition, $5,000 for Indigenous students. So a little bit of an incentive to come into the nursing program. And the bursary is dealt with from financial aid. So it's dealt with registration. There's nothing you need to apply to get the bursary. It just naturally comes off of your tuition. So that's great news for our students. And then we have Veronica Ford. She is a student of ours that just graduated last term. And she gave us this testimonial that she wanted us to share. So she says, as a nursing student, I've learned so much about what it means to be a professional in a career that focuses on caring for the individual and not the disease. I've learned that if you work hard, you can make it through any challenge you face and ultimately thrive. Remember that you make a difference in someone's life and that you can be the voice that advocates for your patients. So thank you, Veronica, for giving us that testimonial. And it just kind of really solidifies the fact that nursing is a profession where you're advocating a lot for your patients. So I hope that sparks a little bit of interest in you. And then I will turn it over to Maggie, who's going to go through some of the admission processes.
Yes, hi. Thank you so much, Jill. That's great. So, yeah, I'm just going to go over some of the overview of the admission and applications process for the BSN program. So next slide, please, Erin. Okay, so here are the application steps. I will go into a little bit more detail for these later in the slides. So filling out the online application is relatively straightforward, and the process takes place entirely online. Once the application opens for each cycle, you can log in and review the online application. You can work on filling out your application at your own pace. It does not go to our admissions department until you have paid the application fee and submitted your online application. And you do have until the application deadline date to submit your completed application. Regarding the application process, you will first review all entrance requirements and the application processing dates. You will need to ensure that you meet all entrance requirements and upgrade if necessary. And do ensure that when you apply online that you have all of your required documents, such as transcripts, ready to upload as PDF files. BCIT.ca/admission will guide you through the step-by-step application process. And then once you're ready to apply online, you can visit bcit.ca/apply. And the application fee for domestic students is $90 Canadian. So some important dates. We do offer 3 intakes per year for the BSN program with 96 seats available per intake. And within an application period, the date you apply does not have an impact on your application. So you do have until the deadline date to apply, but it is not, of course, recommended to wait until the very last day to submit your application. So here are the academic entrance requirements for the BSN program. Do note that there are high school level requirements as well as post-secondary ones. So for the high school requirements, testing and course options are available for English 12. For math, both foundations and pre-calculus and 11 and 12 are accepted, but with differing grade requirements. Chemistry 12 can be used in place of chemistry 11. And additionally, post-secondary subjects can be accepted in place of high school level requirements, as well as out-of-province or international courses may also be accepted. Upgrading options are available for those who do not meet the high school level requirements, so you can definitely contact us in program advising for assistance on navigating upgrading options. The academic foundations courses are at the post-secondary level and can be completed at BCIT or at other recognized post-secondary institutions. If you do choose to complete the academic foundations courses at other post-secondaries, please refer to the PDFs on the nursing entrance requirements page for acceptable equivalence and for information on the general education electives criteria. For those of you with international education, an ICES evaluation report may be required if you choose to use your international post-secondary courses to meet the academic foundations requirements. And there also are two important things to note about the academic foundations courses. Final grades for the academic foundations courses are required by the application deadline date. So if you are in progress with completing the foundation courses and will not have your final grades available by the deadline, you will unfortunately then have to wait until the next application window and the next intake to apply. Additionally, there is a 3-year recency on the anatomy and physiology requirement. The anatomy and physiology requirement must be completed within 3 years from the intake that you are applying for. So some schools do offer it as 2 separate courses. At BCIT, it is 1 course. So if you've completed the course in 2 parts and the first part was completed more than 3 years ago, you will unfortunately not meet the 3-year recency requirement. So those are important things to note. Excuse me. Now on to the non-academic requirements, which is the mandatory applicant questionnaire. So this is a fillable PDF online, so please do type right into this form. Do not cut and paste from other documents. And do note that the boxes cannot be expanded or enlarged, so you should ensure that you provide thoughtful, clear, and concise responses. Admission to the BSN program is competitive, so on this form, the selection committee is going to be looking for relevant work experience, as Jill mentioned. It does not necessarily, though, have to be healthcare related. It can be customer service experience, serving experience such as a barista. What the program area wants to see is your people care and your interactions. And as well, they're also interested in leadership and teaching skills and evidence that you can work with all types of people from various different backgrounds and ages. So as mentioned, your application is completed entirely online, so you'll need to upload your documents to your application. You can download official digital transcripts, or you can convert your transcripts and documents to PDF files by either scanning or taking pictures of them and saving them as PDFs. And do please ensure that you upload all required documents to minimize any delays in application processing. So here's what happens after you apply during the admissions process. Your application will be reviewed by the admissions department to verify that you have fulfilled all academic entrance requirements, and this process can take up to 4 weeks. If you meet the requirements, your application is then forwarded on to the nursing department for further review. This competitive assessment process occurs over typically a 2-month period following the application deadline. The nursing department uses a rubric to shortlist the strongest candidates. And do note that final decisions are made based on everything that you've submitted. But if you do have any questions or require further clarification on this process, definitely please do not hesitate to contact us in program advising. So as mentioned here, we can answer questions regarding entrance requirements, the application process, student resources, success strategies, program schedules, and more. So you can visit us at bcit.ca/advising for the most current information on our services and service hours. And we do offer Zoom, in-person, and email service. So now moving on for the academics, do know that BCIT is committed to supporting students in a holistic sense. We definitely want you to succeed not only in your academics, but also outside of school. Some student services are available to you as a prospective student. Others will be available to you once you become an enrolled student. So there are some important student services that I'd like to highlight. If you are Indigenous, BCIT's Indigenous Initiatives Department is there for you to ensure a smooth transition to your first year. They offer peer-to-peer mentorship, a welcome gathering place, and provide clarification on Indigenous funding. BCIT's awards, scholarships, and bursaries are listed on our financial aid and awards webpage. I would like to mention that we have a President's Entrance Award. Selection for this award is based on academic achievement and volunteer and community service. And you can contact financial aid directly for more information on this. BCIT is committed to providing assistance to students with permanent or temporary disabilities. If you have been accepted to a program and believe you may need accommodation to be successful, I do encourage you to connect with our Accessibility Services Department. BCIT Student Health Services is a health clinic located at the Burnaby campus. They provide medical care for current BCIT students year-round. We also have a counseling and student development department who's available to help you enhance your educational performance and maximize your success as a student here at BCIT. And additionally, our recreation services promotes, encourages, and enables the practice of physical well-being. We consider recreation an integral part of campus life and welcome all students to enjoy their services. So yeah, you can contact us through the different handles you see there for social media, Facebook, X, Instagram, YouTube, TikTok, LinkedIn, etc. So feel free to check out those links for some more information. And you can learn more about BCIT through tours, our Spend a Day service, which is fantastic. You can discover all programs at our Big Info, which we typically hold once or twice a year, info sessions, and of course through BCIT advising. So bcit.ca/advising. So thank you so much for listening to our presentation.
Thank you, Maggie. I know we gave everyone a lot of information rather quickly there. And thank you, Jill, for all the information you shared as well. I got a really good picture of what it's like to be in the program, but also what it's like to be a nurse. And I think that's really important for us to look long term as well. So I haven't been seeing a lot of questions in the chat as you two have been talking. I guess you've been covering a lot of information. People have been listening well. But I do encourage everyone, if you can access the Q&A, to type your questions in there. If you are having any difficulty accessing the Q&A, you can maybe put something in the chat instead, but we would prefer the Q&A if you can try to access that. I know Yuki and Lorene are doing a great job answering some of the questions. So yeah, I'd just like to encourage everyone to put all their questions in there so we can ask them. That's a great question from Michelle. Maybe Jill knows the answer to this one. Do we participate in BCIT Spend a Day for BSN?
Oh, that is a great question. Right now we don't. We'd love to. We need to do some planning around that though. So no, we don't right now.
Yeah, we have a lot of programs at BCIT. Just in health sciences alone, we actually have over 30 programs. So some of them are participating in Spend a Day right now, and some of them aren't. And that list has changed over time. So unfortunately, not BSN, but please keep an eye out on that list if you're interested in the other programs as well. Oh, and maybe Maggie can answer this. What is the approximate tuition cost for the BSN program?
Oh, the tuition cost? Sure, I just will need to look that up. Just one moment. We do have a really great tuition estimator function that's pretty new to BCIT. I can just plug that
I love that on the website. That is so much easier than it used to be.
Yeah, no, for sure. I'm just gonna see. I don't see who asked the question, but let me just put that in here.
It was Chase.
Chase, I do apologize. I don't know if you can see that, the tuition estimator, but actually let me just plug that in myself right now since we have some time. Nursing. Bachelor of Science in Nursing. One moment. Nursing. Okay, so for the full program, it looks like the cost is $23,425 Canadian. So that's the full program. It is broken down by term, and there are 8 terms plus the preceptorship that is factored into this calculation. So again, if you click through using that tuition estimator, you can check out those detailed fees for yourself.
Emily, I see that your hand is raised. Is that because you would like to ask a question out loud because you can't access the Q&A, or?
Yes, I'm so sorry about my audio, but I can't actually access the chat or the Q&A.
Oh no.
Yeah, for the chat, it says chat is only available during the meeting, but like I'm pressing it and it's not allowing me.
Yeah, we're in the meeting. That okay. Well, all kinds of bugs for us to work out with using Microsoft Teams, like I said. Did you have a question for us?
Yes. Okay, sorry. I'm so sorry about my audio. I'm in a public place. But I have a question. So about the English 1177 credit, I'm not sure if you're going to be able to answer this here, but one of the requirements, so there's several ways that this credit can be granted, but I was wondering for the point that says student has completed an undergraduate degree where instruction was in English and where several courses required formal essays and course evaluation. How is this requirement evaluated, and like how many courses do you count as several? My first part of my question.
I think that is a question that you would have to reach out to program advising directly on, and I'll put the slide with their information back up.
All right.
You can see that. That is something that, yeah, we'd have to specifically talk to you about in program advising. So if you want to get in touch with them, that'd be the best way to handle that. Thank you.
So sorry about the
microphone. Oh, no worries at all. And we also have for the people answering questions in the Q&A, we also have one person who asked a question in the chat. If you could address that one as well, please.
Okay. Erin, there's a good question here that maybe Jill could respond to. I'm just seeing it here. Jill, it's Mira asks, should people who struggle with social differences, for example, autism or social anxiety, pursue nursing? How important is it to be a natural and making connections with patients and colleagues?
Yeah, I can certainly answer that. What I answered in the response to that is that you do need to be a strong communicator, but that your communication techniques, it varies from person to person. So as long as you're able to communicate and build therapeutic partnerships with patients, that's key. And only you would know what that looks like. It doesn't mean you need to be supernatural in forming connections, but you do need to have that ability to communicate clearly. So hopefully that answers that question.
Thank you, Jill. I'm so sorry. I didn't see that you had responded by typing. I do apologize about that, but thanks for answering it verbally as well.
And Nadia is asking, for specific admission equivalency courses, should we connect with program advising or admissions advising directly? Yes, Nadia, it would be best to connect with program advising directly on that, because it's hard for us to answer questions specific to a specific transcript or a specific situation in a group setting like this. So definitely you should make some time to connect with program advising on that one. Jill, go ahead.
I wanted to answer this one question that Lauren has. It says she's interested to hear about LPNs apply and go through the BSN program. Are there bridging programs? Is there anything different about the application process or actual program for practicing LPN? So we do actually have a lot of LPNs that come into our program, and probably because they can get into our program and complete the 3 years while they're waiting to get into that bridging program at, I think it's Langara or BCC that has it, but there's a long wait. So yes, LPNs do come into our program. The first couple terms are going to be not as engaging as because it's a content that you likely already know, but it will be presented in a different way. Certainly the way that the program is structured and some of the pathophysiology and nursing implications and whatnot will be different, but the clinical course of doing blood pressure and personal care and mobilizing patients, you would already know that. But it doesn't say that there won't be good learning that will take place. So yes, LPNs do take our program, they do well, but there's other than the prerequisites, you don't get credit for any courses in our program. So you have to take the same courses that everybody else would have to take in the program. Hopefully that answers your question.
But Jill, would being an LPN help with like the work experience side of the application?
Oh, for sure.
For sure, right? Yeah.
Absolutely. It would help you get into the program for sure, because you already know what it's like to work in the hospital and have so much experience to bring forward. I
also wanted to share an answer I just gave to somebody who's I've lost it in the chat now, or in the Q&A now. But yes, this session is being recorded, and a copy of the recording, as well as a PDF copy of the slide deck, will be sent to everyone who registered for this info session. It will be emailed to you within about a week to 10 days of this session, and it will be sent to the email address you used to register for the session. So please give it at least a week before you start wondering if we've missed you, but we will be sending that out, yes. Okay, Sonia and Tanya are asking similar questions in the chat, so I'll answer those as well. They're saying, is there a waiting list? And then how long is the waiting list? The BCIT BSN program does not carry a wait list. So if you are not accepted into the term for which you're applying, you would have to reapply for a future term. Lorene or Yuki, there is a question from Crystal in the chat that you might want to answer.
And Aaron, I'm not sure if this was
Or Maggie.
responded to. Nadia was asking, is there a typical daily schedule for the program, and does it vary from term to term, which I think is quite a good question and a very common one that we actually get as well from prospective students. Jill, did you maybe want to respond to that one?
Yeah, sure. So our program, I can speak for term one. When you enter the program, Mondays is a self-study day, so Tuesday to Friday, you would be expected to be on campus or in your clinical setting doing work, and the hours are typically between 8:30 and 3:30 for term one. But that looks different as you progress through the program. In fact, some placements, particularly in term 5, have 12-hour shifts. So instead of having 2 6-hour shifts, they'll have 1 12-hour shift. So that changes. Then maybe you have 2 days where you might have self-study days at home because you've done all of your clinical hours in one day. I think there was also a question of how can you do this program if you have kids? We certainly do have students that do the program with kids. It's doable. It's just a matter of utilizing your supports so that you have time to complete some of your schoolwork and being able to make it to your clinical shifts and whatnot. So yes, it's absolutely doable. It's really just dependent on the person and managing your time.
I think some of our people are still busy typing away. I just wanted to give a shout out and a thank you to Yuki and Lorene, and who else do I have in the chat? Yeah, Yuki and Lorene, who are furiously typing answers into the Q&A, and they're being silent on here today because they're busy typing and they're not speaking out, but big shout out to them and all their hard work right now, getting your questions answered. Sangreet, I see that you have your hand raised. Did you want to unmute and ask a question? Is that what that hand meant?
Yes, please. Sorry, I don't have access to Q&A.
Okay.
If we have done the high school courses, all of the high school outside of Canada, let's say in India, is that accepted? Courses like chemistry, physics, chemistry and biology and English?
Maggie, is that something you could possibly address?
Yeah, for sure. So I've linked it several times in the chat. I'm not sure if you're able to see the chat or not, but we do have a high school equivalency guide published on our website. Were you able to see the chat at all to view those?
Yeah, I don't see the answer though. I see a few questions.
I know, actually, I couldn't see the answer before either. If you click on it says view comment, if you click on that, you can see them. Otherwise, it doesn't seem to be popping up for me either. I couldn't see, like, for example, when Jill had answered, I didn't see that myself. So let me link it again at the top. I'll just do the discussion myself here. Here is the guide I was talking about. So let me just link that for you. One moment. I will say, however, that if you are not from an English-speaking country, that the English 12 would not be acceptable, so that would have to be either upgraded through a course or testing. Chemistry and math, it is possible that those high school subjects could be accepted from other countries. That might be possible. Just check that guide that I linked, but English likely would not be.
All right. If English is done here from one of the colleges that are accepted in BCIT,
yeah, that could be definitely.
Is that okay, or we have to do IELTS or something?
No, if you have I'll just show you again. Let me just go link the English requirement. I can link that in a new chat as well. And you can just look. There are post-secondary English courses are accepted in lieu of English 12. So that's a possibility. So I'll just link that again in the chat there. And again, if you can definitely contact us in advising if you have some more individual questions like these, and we can guide you through step by step. So that might be a better way. If you have more specific questions such as those, we can chat with you directly. That's no problem.
All right. Thank you so much. I appreciate that.
Yeah, no problem.
I can answer a question from Nadia asking, is there a limit on how many students can participate in the employed student nurse? And that's a great question, because our students do have this opportunity, typically once they complete term 3, to apply to a variety of different student nursing jobs, and that really helps. They make pretty good money doing this work, and it helps fund their schooling and gives them lots of valuable experience. So we don't actually set the numbers of how many BSN, they're called, positions there are. The health authorities are the ones that seek out the student nurses for those jobs. So we don't really have anything to do with it, but our students are certainly getting lots of opportunities in that way.
And someone asked, Jill, Tiana was asking, are there any extracurricular first aid courses needed in order to be fully accepted to the program?
Yeah, so you will see on the website that you do need to take first aid and CPR once you are accepted into the program. I mean, you could take them before, but the requirement is that you have to have them once you start the program. So you don't have to do them right now.
Okay, well, I think I'm going to close this off about now. I really appreciate everyone's questions this evening. We had a lot of really good ones in the chat. Again, I've left this program advising slide up. Program advising is a wonderful resource for people thinking about applying to the nursing program at BCIT. They can answer all of your questions and help sort out any issues with your transcripts or what course qualifies for what. But again, there's also lots of great resources on that on our BCIT nursing program webpage. So please make sure you read through all the program entrance requirements on the webpage, because there are a lot of resources there as well, and a lot of the answers to a lot of questions. Thank you again for joining us this evening. I hope using Teams wasn't too disruptive. It actually, I think, went fairly well for our first time, but I don't want to jinx anything further by saying that. So again, within a week to 10 days, everyone who registered for this info session will receive a copy of the slide deck in PDF and also a link to the recording for this session. Again, thank you very much. We really appreciate your interest in nursing. We hope to see you guys at BCIT sometime.
Thank you.